Hi there, Steve from North East Functional Health, and the little video topic we're going to be talking about today is scarring and how it can interfere with how things are operating in that local area. Now, one of the things that we're always interested in when we're talking to people and doing their original intake is whether they have any surgical scars and whether they have any sort of traumatic scars. The reason for this is scars' effects on the nervous system can be quite pronounced in a couple of different ways depending on the type of scar. Now, if you kind of think of a surgical scar for the moment, then imagine that you have had abdominal surgery, and people kind of commonly refer to scar tissue. Imagine that scar tissue is kind of somewhere in your abdomen, and it kind of has that kind of effect. So things kind of get pulled taut in different directions. Now, it's very common to find that surgical scars don't like being stretched in different directions. We have stretch receptors, Golgi tendon organs, in our connective tissue, so the tendons and the ligaments, which should be able to tolerate stretch. Now, when they become hypersensitive to being stretched in a particular direction, muscles will either lock down or kind of go weak as a response. And that is something which we need to find and we need to treat. And this is why there's fairly high incidence or a higher incidence of women who've had a C-section who go on to have lower back pain than women who have a natural birth who go on to have low back pain. Again, this kind of counts with surgeries for hernias, disc surgeries, anything doesn't always, but can cause dysfunction that we need to find and treat. Traumatic scars are a little bit different. Imagine that you have burnt yourself or cut yourself. Effectively, you get like a withdrawal reflex locked in your system. So, for instance, you touch something hot and you just automatically recoil. Now, those muscles have the potential to stay in that kind of recoiling state even after that stimulus has gone. And that can be the same for if you cut yourself on glass, burn yourself and whatever. The last thing that we can find in clinic sometimes with people, and again it's not all the time, is that tattoos do count as scars. Obviously you're kind of undergoing these willingly, however you are sat there while someone is repetitively stabbing you with a needle. And it's the same thing. A normal response to someone stabbing with a needle is withdrawing from it, and that is reflexive. So it is not something that's under conscious control. These are things to look out for that we always look out for when working with people, particularly if they've had treatment elsewhere and they haven't got the result or haven't got pain-free or kind of things keep coming back. So if you have got scarring and it's not been treated by whoever you're seeing, then get in contact and we can fairly quickly usually find out whether a scar needs to be treated or not. It might be the thing that, if treated, gets you pain-free and where you want to go.